Wednesday, 1 o'clock coronavirus press conference. As a reminder, I'll be holding these press conferences once a week on Wednesdays at 1 o'clock going forward. If we need to, as things arise, we'll have them more frequently, but right now, once a week feels like the right cadence. I would strongly encourage you, if you haven't yet, to sign up for the daily emails. You can do that at governor.ri.gov. Since we're down to once a week for the press conferences, getting the daily email is a great way to keep yourselves informed. governor.ri.gov. I'll begin, as we always do, with a quick look at the data to give you a sense of how we're doing here in Rhode Island. People ask me all the time, hey, Gov, how are we doing? So please, if you could put on the screen the data. Yesterday, we had 76 new cases, and very sadly, 1 additional death. That additional death takes us to 997 Rhode Islanders that we have lost to coronavirus in the past few months since we've started this. Very sadly, I expect that we will reach 1,000 deaths, on the next day or 2 or 3. And at the time that we reach 1,000 deaths, I plan to order the flags lowered to half-mast here in the state of Rhode Island and illuminate the State House red, white, and blue as a tribute to the 1,000 lives lost to this deadly virus and to the over 140,000 Americans whose lives have been lost in the past few months to coronavirus. I will say that for me, to have to get the data every morning and see that we continue to lose lives is just a reminder that the virus is with us. It's taking loved ones from us every day, and it means that we have to work even harder, each and every one of us. So if you see the flags at half-mast later this week, see the State House lit, you know why. It's 1,000 loved ones. Take a moment, say a prayer for the lives lost, and ask yourself, what more can I do to fight coronavirus so we keep Rhode Islanders safe? To that end, I want to make a few announcements today to talk about exactly that. What can we, the people of Rhode Island, do to keep ourselves safe and healthy while we continue to live with coronavirus? And I want to start today talking briefly about mask wearing. I will say overall, Rhode Island is doing very well. You see look all around the country what's happening. It's very, very sad what you're seeing happening in Florida, Arizona, California, Texas, Alabama, Mississippi, Kentucky, seeing new peaks. And those states who had been a bit slower to mandating mask use are all one by one coming around to mandating mask use. The reason for that is because it works. It's really very simple. It works. It's inexpensive, it's easy to do, and it's highly effective. And it is most effective when everybody has a mask. So I will say here in Rhode Island, we were on that early. We were one of the first to go to mandatory mask wearing, and I have to say thank you. By and large, Rhode Islanders are wearing masks. Last weekend, one of the hottest weekends we've had, if not the hottest, this summer, our inspectors were out in force. We saw almost 95% mask compliance among employees that were working in bars and restaurants and retail, and 90% mask wearing among customers. So obviously we want to be at 100%. There's room for improvement there, and I'd ask us all to try a bit harder. But by and large, we're doing a great job. So the thing we have to do is stay at it. People say to me often, why is Rhode Island doing so well? Why are we managing to stay at that plateau? Mask wearing is a big part of the reason, and that's because of you. So let's try to get from 90% to 100%, and most important, let's not get lazy. And I'm talking to everyone, myself included. It's hot. This has been dragging on for months. It's easy to forget. It's easy to say it's too hot, I don't feel like it, I'm just with people I know, I'm just with my friends. And so I'm just asking you to not let yourselves get lazy, not get complacent, be vigilant, keep it on you, stick it in your pocket, have a bunch in the car, keep it at your desk in the office, and just please try to maintain mask wearing. And to those of you who are saying you don't feel like it, or you're sick of doing it, or it's too hot, I want you to remember this. There are thousands of Rhode Islanders who have had to work every day throughout this crisis. Grocery store clerks, bus drivers, child care workers, first responders, nurses, doctors, the list goes on and on and on. These people have had to work every day, all day, with their mask on, all day. If you're in the hospital, you work in a nursing home, you work in a hospital, work at a grocery store, you work at a bank, you don't have that luxury of saying, I don't feel like it, I don't want to, it's too hot. Every day, 8, 9, 10, 11 hours a day, wearing their masks for the past 5 months. We owe it to them to wear our masks, to keep them and our friends and our relatives and our neighbors safe. And so that's why I'm asking all of us to try a little bit harder. It is inconvenient. I understand that. It's strange, it's inconvenient, it's a hassle, it's hot, but we have to do it. It works, it will save lives, and every time you feel frustrated, I'd ask you to just think of the thousands of Rhode Islanders who have had no choice but for the past number of months, every day, all day, at work, having to wear their masks. Second thing I want to talk about is social gatherings, and particularly bars. Today's theme is, what can we do to reduce deaths and hospitalizations? What can we do to keep our plateau? And one of the key things is limit our social gatherings. So on the good news, as I said, we've had between 90 and 95% compliance with mask wearing. Thank you. We're not doing as well with our social gatherings. And I want to say this. I know we've been cooped up. We're sick of it. We're sick of living like this. I hear you. If I could make the virus disappear, I would. But I can't, and no one can. So we have to keep living like this. Social gathering limit is 25. It's not 30, it's not 35, it's not 100, it's 25. And you should be doing everything you can to keep your, circle of people that you're with small. You shouldn't be out every night with a different group of 25. And we are seeing that that's an issue. I want to say this very clearly. We got to get people back to work. We have to get these kids back to school. The only way we're going to be able to do that is if we keep a lid on the virus. We want to get back to school in the fall. The best way to do that is to reduce the prevalence of the virus even more between now and then. We want to go into that experience with a very low rate of % positive. There's still tens of thousands of Rhode Islanders out of work, restaurants that haven't reopened, small shops that haven't reopened. We owe it to them to allow them to get back to work and back to school. And the only way we're going to do that is if the rest of us obey the rules. I want you to have a good time. I want you to have a barbecue. I want you to go out. I want you to have a fun summer. But your right to have fun and party and go to social gatherings cannot and should not infringe upon other people's rights to go back to work and to go to school. And so I'm asking all of us to try harder. And you may say, how do I know we're not? Because we see it. Our inspectors see it in crowding in bars, crowding in restaurants, crowding on boats, boats lined up next to each other, many more than 25 people, social gathering, not mask wearing. And also, we see it in our contact tracing. We're seeing a lot of cases contact trace back to backyard parties, where there were more than 20, 25 people, and not surprisingly, the whole group of people in that backyard got sick, and then they left the backyard party and they went someplace else and infected more people. So it's crystal clear from the data, from the inspections, and from the contact tracing. The Department of Health continues to do a phenomenal job with contact tracing, and I would say it's frustrating. It is frustrating when we see that we continue to lose lives, and yet people are just not paying attention to the rules. And when you do the contact tracing and you find out that a dozen or more cases were attributed to a single backyard barbecue where there were 30 people. So we have to try harder. We have to try harder. Have folks over, 10 people, wear masks, make sure no one is there if they're sick. It's simple, it's necessary, and it'll save lives. I especially want to talk to young folks, people between 20 and 29. You guys have to try harder. The overall test positive rate in Rhode Island right now is about 2%. So that's excellent. We have to stay below 5%. Our percent positive rate among 20 to 29-year-olds is 3.5%. Now, it's not because 20 to 29-year-olds are more susceptible to the virus. We know they're not. It's because too many young people aren't following the rules. Now, the good news is if you're a healthy 20 to 29-year-old, probably your risk of mortality from this disease is not as high. The bad news is you're going out into the community and infecting people who are vulnerable, who are winding up in the hospital or worse. So, and again, this isn't unique to Rhode Island. This is playing out all over the country. We're seeing that group, and I know it's summer. I know it's a time to be with your friends. I understand it all. You just need to know that when you're out and you're at a rented beach house and there's 40 people at a party, you're breaking the law, you're risking people's lives, you're making it harder for kids to go back to school, and you're contributing to our 12.5% unemployment rate. So we all belong to each other. It's not just about you. It's about what you're doing that hurts other people, and I'm asking you, please, to try harder and just obey the rules. Same goes for bars. I'd like to remind everybody what the rules are around bars. Currently in the state of Rhode Island, bars are not allowed to operate like bars that we think of. They can operate like a restaurant. Bartenders can make drinks, and those drinks can be delivered to tables by waiters without people sitting in a bar. You cannot sit at a bar with a bartender, order a drink, and sit there. If you're going into a restaurant and that's happening, it's not allowed. If we come in and inspect your restaurant and that's happening, we're going to close your restaurant. It's not allowed. You can have socially distanced seating at a bar to serve food as long as there's no bartender there. And there can be a plexiglass divider there for a bartender to pass drinks to a server. But right now in Rhode Island, you cannot operate a bar like a normal bar, what we would think of as a bar. Think of it as a restaurant. Unfortunately, we aren't seeing what we need to be seeing in terms of compliance with bars. So I am now looking at different options for how we can change the regulations for how bars operate. We're going to do a big round of inspection this week and this weekend, and if we don't see better compliance, then I'll be back next week with more stringent rules and a further shutdown of bars, which, by the way, I really don't want to do. You know, I've been trying to talk to a lot of restaurant owners, going out as much as I can, and folks are struggling. Even the restaurants that are back open, at the very best, they're doing 60, 70% of their typical business. The last thing that we want to do for them is for me to have to say, cutting back their business. But I will say that will be necessary if by this point next week we don't see better compliance. Because again, we're all linked together. I understand it's a social time of the year, but if we can't keep our cases where they are or lower, that'll infringe on our ability to get the kids back to school. It'll infringe on our ability to continue to open the economy. And so we just all need to know that we have to try a little harder with social gatherings, keep them smaller, and I'm asking restaurant owners and bar owners to be more vigilant about enforcing the social distancing, and frankly, Rhode Islanders, us. Let me say this, I'll keep it very simple. If you find yourself at a restaurant, in a crowd, standing at a bar, in a crowd, you're doing something wrong. And I would ask you please to, either leave or go find a seat or make a different plan. Okay, I want to talk for a second about testing. There's been a lot of news lately all around the country around testing delays, and unfortunately, Rhode Island is not immune from those delays. You hear stories, and I hear stories of people waiting a week or more to get their test results. I can tell you that's not the norm. I can tell you that here in Rhode Island, the average time is much less than a week. Having said that, we're not where we need to be. We want to be at 48 hours. We want to be 48 hours gold standard, 2 to 3 days acceptable. And we do have too many people waiting longer. It's obviously not a problem unique to Rhode Island. It's a struggle everywhere. The reason is because commercial labs all over the country are overwhelmed, and that's causing a backlog. Dr. Alexander Scott is going to address this issue at length in her comments. I just want to let you know I understand it needs to get better. I'm committed to making it better. And the approach that we're taking is to try to become a little less dependent on the commercial labs and become, over time, just more dependent on places like the state lab, local universities, local labs, frankly, that we have some more control over. And we hope that that will reduce the wait time. And I'm sorry for those of you who have had to wait longer than you should have to wait. My primary message on testing today is more folks need to get tested. So right now, we have a daily capacity to perform over 5,000 tests a day, but on any given day, we are just at about 3,000. So we have, obviously, capacity to do more. So if you're listening to this press conference, the main message I'd like you to take around testing is that more people need to get tested. And so what does that mean? It means if you have symptoms, you're not feeling well, you have a headache, you have a fever, you have the sniffles, you're congested, you're coughing, please call your doctor and go get tested. Please, we need to do more testing. We need to know what's going on in the population. We need to get contact tracing going on people who test positive. Call your physician, go to a qualified health center, community health center, go to one of the walk-up testing centers, one of the community testing centers. We need you to get tested. If you're a personal service worker, or if you're a gym employee, a child care worker, a bus driver, a waiter, a waitress, member of the clergy, anyone who works with the public, who works in a retail operation, please go get tested. It's free. You can go to portal.ri.gov, portal.ri.gov, sign up for a test and get tested. And obviously, if you think you may have come into contact with somebody who you know had the virus, please get tested. If you're worried, let's say a coworker tests positive, you're worried you were in contact with them, please go get yourself tested. And obviously, if you get a call from the Department of Health who tells you you've been in touch with somebody, definitely go get tested. At this point, Rhode Island remains the nation's leader in testing. We've tested the equivalent of 30% of our population. and we're testing. We want to do more, though. You know, we're the leader, but we want to, first of all, stay the leader, and second of all, especially as we look towards school, we want to increase our testing as much as we can. Okay, a happy announcement. I'd like to say thank you. About a month ago, I announced the We Are One Rhode Island Fund to help Rhode Islanders who are ineligible for federal relief due to their immigration status. At that time, I said I'd like to raise $3 million of private money in order to distribute the money on prepaid cards, $400 at a time for cash assistance. And I'm very pleased to say we have exceeded the goal of $3 million, so we will be able to provide some modest relief for thousands of Rhode Islanders who are undocumented immigrants. And to all of you who gave money, thank you. Thank you. You know who you are. I appreciate every penny. Every penny matters. This is money that's going to be used for food, gas, basic necessities, groceries, for Rhode Islanders, our neighbors who aren't eligible for any aid due to their immigration status. So thank you. If you haven't yet given and you find yourself with a little spare change or a lot of spare change, I'd like you please right now to text We Are One to 27126. They'll send you a link and you can donate. Thank you very much. A note to folks in nursing homes. First, a note of thanks. The visitation, new visitation policies at nursing homes is so far going very well. So I'd like to thank nursing homes for doing a great job, for their cooperation. Most of these visits are happening outside. They're pre-scheduled, but our seniors so desperately needed that to happen. And I just want Rhode Island to know, going by and large, very well without incident. Great job by nursing home administrators. Having said that, it's still hard to see our loved ones physically. So today I'm excited to announce $100,000 in grants to nursing homes to help more residents digitally connect with family and friends. Eligible facilities will receive up to $3,000 to purchase smart devices and related accessories for residents, and nursing homes can apply for the funding right away by going to the EOHHS website. This is funds directly coming to us for this purpose from the federal government. I'm also excited to launch a virtual community center for older Rhode Islanders. This is going to be in partnership with the Office of Healthy Aging and Age Friendly Rhode Island. We can't all get together in person the way we would like to, so this new initiative is going to be available on the Age Friendly website, and I want to thank the folks at Age Friendly for coordinating with my Office of Healthy Aging. It'll include wellness programming, chats, opportunities for seniors to talk with other people, other seniors, technology training, chat times, educational programming, entertainment programming. It's just an opportunity to keep our seniors active, healthy, informed, and engaged while we are still living through coronavirus. So I want to thank everybody for that and thank the Tech Collective and all of our partners for making this possible.